while we collected the data pre-COVID, in many ways, I think so many of the recommendations that are coming out of this report in terms of the kinds of supports that teachers need and more supportive work environments, I think are even more salient today as they're trying to navigate teaching and learning and communicating around health and safety in this new environment, in this very changed landscape for thinking about sexuality and risk and relationships and our bodies with adolescents. I don't think public health has ever had a moment where more of us are paying attention to things like hygiene and setting boundaries and understanding consent and thinking about the well-being of ourselves and of others. So health and physical education teachers have such an important role to play in helping to young people to think about their bodies and their well-being and making safer decisions and reducing risks to themselves and to others. And the kinds of conversations that we're having around COVID and around setting boundaries and asking people to please respectfully wear a mask and please respectfully not come close and practicing setting those boundaries are so relevant to sexuality and well-being and practicing those skills of consent. So I think the ways that teachers are being even more surveilled now as they all zoom in to talking with their students this week. And, many of them are literally teaching in their living room and teaching into other people's living rooms. So never has there been a point where their work is so surveyed. I think the very important lessons they shared with us pre-pandemic are even more pressing today.